63% of men over 45 are walking around right now with blood pressure numbers that are higher than they should be. Not borderline, not a little elevated, clinically elevated, heading in the wrong direction. And the majority of them feel completely fine. That's the unsettling thing about blood pressure. It gives you no warning, no pain, no signal. It builds quietly, month after month, year after year, while your arteries are silently stiffening, while the muscle wall of your heart is gradually thickening, while your kidneys are working harder than they were designed to work. Until one morning, a doctor looks at a number on a screen, and something about the conversation shifts. I've been practicing family medicine for over 12 years, and in that time, I've sat across the desk from hundreds of men who were genuinely blindsided by an elevated reading. Men who exercised, watched what they ate, thought they were doing everything right. The absence of symptoms creates a false sense of security that is, frankly, one of the most dangerous features of this condition. Now, there are 3 specific techniques, things you can do right now with your own body, no medication, no equipment, that have been shown to bring down systolic blood pressure, sometimes within minutes. And I still meet patients every single week who have never heard of any of these. That tells me something about how health information reaches people, or more often, doesn't reach them. Stay with me until the end. The third technique is the one most people skip. It also has the most compelling long-term data behind it. But before the techniques, I need to walk you through what's actually happening in your body when pressure climbs. Because if you understand the mechanism, you'll understand why these methods work, and you'll actually use them. Most people think of high blood pressure as a heart problem. And yes, the heart is involved, but the root of the problem is vascular. It lives in your blood vessels. When blood pressure rises, what's happening is this. The smooth muscle wrapped around your arterial walls is contracting. Your vessels are tightening. Their walls are becoming stiffer, less elastic. And the branch of your nervous system responsible for this state, the sympathetic nervous system, the fight or flight branch, is running in a state of chronic low-grade activation. Now here's what I want you to hold on to, because this changes the picture completely. That chronic sympathetic activation is not just caused by stress. It is driven, in significant part, by something called insulin resistance, a metabolic state that is increasingly common in men over 45 and frequently completely invisible until something goes wrong. When your cells become resistant to insulin, your body compensates by producing more of it. And chronically elevated insulin does 3 things that directly push blood pressure higher. It stimulates the sympathetic nervous system. It signals the kidneys to retain sodium, pulling more fluid into your bloodstream, increasing the volume your heart has to push against. And it triggers a process called vascular smooth muscle hypertrophy. The walls of your arteries literally thicken over time, becoming stiffer, less able to dilate when they should. This is why cardiologists and endocrinologists are increasingly telling the same story. Hypertension and metabolic dysfunction are not separate conditions. They are different expressions of the same underlying disruption, playing out in different organs. A man walking in with elevated blood pressure is very often also a man whose metabolic health has been quietly deteriorating for years, independent of what his fasting glucose number looks like. I'm telling you this because the 3 techniques you're about to learn don't operate on the surface. They work on the nervous system directly. They shift your body from tight, activated sympathetic overdrive into parasympathetic mode, the mode your body uses for rest, repair, and recovery. And that shift has a direct, measurable effect on your arterial tone and your blood pressure reading. Let's get into it. Technique number 1, ear massage, specifically auricular vagal stimulation. I understand how this sounds, and when I first looked at the research on this, I was skeptical. Rubbing your ears to lower blood pressure seemed like something from a wellness blog with no citations and a lot of stock photography. But then I looked at the anatomy, and the mechanism became impossible to dismiss. Running through the inner curved surface of your ear, through that bowl-shaped area near the entrance of the ear canal, is a branch of the vagus nerve. The vagus nerve is the longest cranial nerve in your body. It connects your brainstem directly to your heart, your lungs, your digestive tract. It is the primary neural highway of the parasympathetic nervous system, and the ear is one of the very few places on the external surface of the body where you can stimulate the vagus nerve directly, mechanically, with nothing but your fingers. When you apply slow circular pressure to that inner curved area, not inside the canal itself, just at the entrance, that concave inner surface, you mechanically activate that auricular branch. The signal travels up the nerve to the brainstem. The brainstem responds by reducing sympathetic outflow and increasing parasympathetic activation. Heart rate slows, arteries dilate, peripheral resistance drops, blood pressure comes down. Research on auricular-vagal stimulation has shown reductions in systolic pressure of 5 to 8 millimeters of mercury in a single 90-second session. 5 to 8 points might sound modest, but sustained reductions of 5 millimeters in systolic pressure are associated with a 14% reduction in stroke risk and a 9% reduction in coronary events. These are clinically meaningful numbers. Here's the method. Use the tip of your index finger or your thumb. Place it at the inner curved surface of your ear, near the entrance of the ear canal. Apply firm but comfortable circular pressure, slow, continuous circles. Not pressing inward into the canal, just circular motion against that curved inner bowl. 90 seconds. Both ears simultaneously is ideal. One at a time works fine. The pressure should feel firm but not uncomfortable. If you find a spot that feels particularly sensitive or tender, that's often an indicator of higher nerve density in that area. Slow down there. Work that spot gently before moving on. Over time, as you become familiar with the anatomy of your own ear, you'll develop a feel for where the response is strongest. You can do this at your desk, in your car, before an appointment, sitting in a waiting room. It takes 90 seconds. And if you've ever noticed that gently rubbing your ear feels strangely calming, now you know exactly why. You are triggering the vagal response without realizing it. And this connects directly to technique number 2, because they act through overlapping pathways. Technique number 2, the body scan. I'll be direct about something. When I mention this to patients, roughly a third of them nod politely and never actually try it. The words body scan carry baggage. They conjure an image of 45 minutes on a yoga mat in a silent room, which is not how most people's evenings look. This takes 60 seconds. It works in a chair, in an office, before a stressful conversation, and it has real, documented physiology behind it. Here's the principle. Your brain is continuously monitoring the state of your body. This process is called interoception. When your attention is fragmented, scattered across a to-do list, replaying a difficult conversation, half present, half elsewhere, your nervous system defaults to a background state of sympathetic activation. Muscle tension accumulates throughout the body, most of it completely unconscious. Breathing stays shallow. The smooth muscle around your arteries stays in mild constriction. When you direct slow, deliberate, continuous attention through your body, moving systematically without trying to change anything, the brain's monitoring system reassesses. It registers something close to, the organism is safe, the organism is present, there is no active threat. And in response, it begins to release background tension, deepen the breath, and reduce the sympathetic drive to vascular smooth muscle. That reduction translates directly to lower vascular resistance. Lower resistance, lower pressure. The method is this. Sit with your spine reasonably upright. A chair is completely fine. Close your eyes. Take one slow breath in through your nose, about 4 counts. Out through your mouth, about 6 counts. Just one breath. Don't try to force anything deeper than that. One deliberate breath is enough to initiate the shift. Then begin at your feet. Simply place your attention there. You're not trying to relax them or change anything about them. Just notice them. The temperature, any sensation, any weight, the feeling of contact with the floor, 5 or 6 seconds. Then move upward. Lower legs, knees, thighs, hips, abdomen, chest, shoulders, arms, from the upper arm down to the fingers, neck, face, the scalp. The full sequence takes 60 to 90 seconds. Some people find it helpful to imagine a gentle warmth moving upward through the body. A slow wave, a soft fog, passing through each layer of tissue, coaxing it to soften and release. The imagery itself is not the mechanism. The mechanism is the sustained, moving attention. But if the visualization helps you stay present rather than drifting back to your mental to-do list, use it. Whatever keeps your attention in the body and out of the head is the right tool. One practical note. The most common mistake is rushing. People move their attention upward so quickly that the exercise is over in 15 seconds and nothing has shifted. Give each body region a genuine moment of awareness. You're not checking boxes. You're allowing the brain to register what's actually happening in that tissue. I want to say something here that I think matters more than the technique itself. The reason so many men over 45 are dealing with elevated blood pressure is not because they're careless or undisciplined or not taking their health seriously enough. The conditions most people are living under, chronic low-grade stress, fragmented sleep, ultra-processed food, sedentary work, constant information overload, create precisely the internal environment that sustains sympathetic overdrive. Your body is responding exactly as it was built to respond to those inputs. You are not broken. You've been given an incomplete picture of what's actually keeping your numbers elevated. Now, the third technique operates through a completely different mechanism from the first two. It's physical rather than neurological, and when done consistently, it produces the most sustained improvement of the three. Technique number 3, the warm foot bath. Let me walk you through what your circulatory system is doing when blood pressure is elevated. A significant component of what your blood pressure reading reflects is something called systemic vascular resistance. The total friction your blood encounters as it moves through all the vessels in your body simultaneously. The more constricted your vessels, the higher the resistance, the harder your heart has to push, and the higher the number on the monitor. Here's what heat does to that equation. When you place your feet in warm water, comfortably warm, somewhere around 38 to 40 degrees Celsius, that's roughly 100 to 104 degrees Fahrenheit, the thermal stimulus causes the peripheral arteries in your feet and lower legs to vasodilate. They open up. The smooth muscle surrounding them relaxes in response to the heat. Blood redistributes toward the extremities, away from the central circulation. That redistribution directly reduces total systemic vascular resistance. Less resistance means the heart doesn't need to push as hard. The pressure reading comes down. 10 to 15 minutes is the window where research shows the most consistent acute effect. Not 5 minutes, not 30. 15 is the practical target. Less than 10, and you don't get the full vasodilation response. More than 30, and there's no additional benefit, and you risk the water cooling to a temperature that loses the effect anyway. Now, if you add magnesium sulfate to the water, Epsom salt, available at any pharmacy for almost nothing, you get an additional mechanism working in your favor. Magnesium is a natural calcium channel blocker. It competes with calcium at the receptor sites on vascular smooth muscle cells. When those cells can't contract as strongly, the arteries they surround stay more dilated. Transdermal absorption of magnesium through the skin is modest but documented, and it's most consistent through areas with thinner skin, which includes parts of the feet and the skin between the toes. 2 generous handfuls of Epsom salt per basin is enough. You don't need to use more than that. The concentration plateaus in terms of skin absorption relatively quickly. The combination of thermal vasodilation and magnesium-mediated smooth muscle relaxation creates a compounding effect that neither alone produces as reliably. Let me give you a concrete example of what this looks like in practice. Think about someone like Marcus, 52 years old, works as a project manager, high-pressure environment, frequent travel, the kind of schedule where a proper dinner before 8 in the evening feels like a small victory. He was consistently reading between 145 and 152, over 92 at his checkups. Not at the threshold where most current guidelines push for immediate medication, but clearly trending the wrong direction. And he knew it. He came in not looking for a prescription. He came in asking what else he could actually do. We talked about the foot bath. He was skeptical, which was fair. It sounded too simple. But he agreed to try it. 4 evenings a week, 15 minutes each session, warm water with 2 generous handfuls of Epsom salt. He set up a small basin near his television, so it didn't require carving out separate time or disrupting his routine. 15 minutes he was already spending sitting down anyway. 6 weeks later, his average reading had dropped to 137 over 87. He hadn't changed his diet, hadn't started a new exercise program, hadn't added any supplements, just the foot baths, consistently, 4 times a week. That's a reduction of 15 points systolic, without a single medication. Studies examining regular thermal foot bathing, 4 to 5 sessions per week, have shown not just acute pressure reductions during the session itself, but sustained improvement in baseline blood pressure over time. The proposed mechanisms include progressive improvements in endothelial function, which is the health and responsiveness of the inner lining of your blood vessels, and beneficial long-term adaptation in autonomic nervous system resting tone. And that same metabolic and vascular pathway we discussed at the beginning, Regular thermal vasodilation begins to improve how vascular tissue responds to insulin signals over time. The arteries become, very gradually, more responsive again, more elastic, better able to do the job they were designed to do. This is not a dramatic overnight transformation. It is the kind of consistent, compounding improvement that changes your numbers meaningfully over months and changes the underlying biology, not just the surface reading. Here's how to put all three together. You now have 3 tools, each targeting blood pressure through a different biological mechanism. Ear massage stimulates the auricular branch of the vagus nerve, triggering parasympathetic activation and arterial dilation. 90 seconds, no equipment, works anywhere, anytime. The body scan shifts the brain's interoceptive assessment from threat mode to safety mode, reducing sympathetic drive to vascular smooth muscle. 60 seconds, a chair. The only requirement is that you actually slow down enough to do it. The warm foot bath uses thermal vasodilation and magnesium to redistribute blood flow and reduce total peripheral resistance. 15 minutes, warm water and Epsom salt. The one technique that builds cumulative benefit over weeks and months of consistent use. If you want to start tonight, start with the ear massage. Lowest barrier to entry, and the calming effect is often noticeable within the 90 seconds themselves. Do it before bed. Do it during a work call if no one can see you. Do it anytime you feel your system running hot. If you want the most meaningful and sustained long-term change, build the foot bath into your evening routine, 4 or 5 times per week. Pair it with something you're already doing: television, reading, a phone call with family. The data behind regular practice is genuinely compelling, and the cost is essentially nothing. And if you are currently on blood pressure medication, please do not use any of this as a reason to stop without talking to your doctor first. That would be genuinely dangerous. What I hope these techniques give you is something concrete to bring to your next appointment. Real observations, real changes in your numbers, so that you and your physician can make better informed decisions together about your treatment going forward. The goal is not to replace medical care. The goal is to change what your body brings to every appointment. The core insight I want to leave you with is this: your blood pressure is not a fixed biological property. It is a dynamic readout of your nervous system's current state. A state that is shaped by your metabolic health, your stress response, your sleep, your daily habits, and the inputs your body receives every single day. All of that is influenceable. The same insulin-driven metabolic disruption that quietly accumulates over years is stiffening your arterial walls and keeping your sympathetic system in a state of chronic, low-grade activation. Targeting the nervous system, which is exactly what today's 3 techniques do, is one of the most direct and accessible levers available to you. No appointment required. No prescription required. No waiting for a problem to become a crisis before you start responding to it. You don't have to wait for a crisis to begin. You can begin tonight. If this was useful, it would genuinely mean a lot if you subscribe. It helps me keep producing evidence-based content like this, focused on the actual mechanisms rather than the oversimplified version you'd get in a 5-minute appointment. There's much more coming on blood pressure management, arterial health, and the metabolic science that drives most of what men over 45 are quietly dealing with. If there's a specific topic you'd like me to cover next, leave it in the comments. I read every one of them. See you in the next one.